Welcome to Soleo Health, where we help you simplify your complex care. In this video, you will learn about the signs and symptoms of bleeding in hemophilia. We will review the types of bleeds, complications from bleeding, and when to seek care. We hope this educational video helps you identify a bleed, whether you are a patient or caregiver. The goal is to prevent bleeds and treat the bleed as soon as you can. First, let's review the types of bleeds that may occur. People with bleeding disorders can have minor cuts that don't clot, or the bleeding stops and begins again. They can also have spontaneous nosebleeds that can be recurrent and heavy. External bleeding can also occur in the mouth after biting the mouth, lips, or tongue. The most frequent sites for internal bleeds are the joints, usually the knee, ankle, elbow, and hip joints. At first, the joint may be described as tingly or bubbly. As blood begins to pool, the joint may feel tight, may be warm or hot to the touch, and can become painful, especially when bending. Children may hold or protect the injured joint, or start limping or crawling. Repetitive joint bleeds can cause irreversible damage to the joint. Once you have had one bleed in a joint, you are more likely to develop future bleeds in this same joint. Internal bleeds can also occur in muscles, particularly the groin, forearm, calf, thigh, or buttock muscles. Muscle bleeds can be extremely painful, and numbness and pale skin may be noted over the injured muscle. If left untreated, this can lead to nerve damage. Always seek medical attention or contact your hemophilia treatment center to report your symptoms. Soft tissue bleeds can occur and present with large bruising under the skin. While the bruising looks severe, this is not usually painful. Bleeding of the gums can occur, and bleeding can be difficult to stop when you or your child lose a tooth. Always contact your hemophilia treatment center to notify your team of any dental issues. Bleeding can also occur within the brain and is very serious. This type of bleed can occur spontaneously or after an injury. Signs of a possible brain bleed are painful headache, stiff neck, sleepiness, vomiting, sudden weakness, behavioral changes, difficulty with balance or walking, double vision, convulsion or seizures. Other bleeds requiring immediate attention include those in the eye, throat, gastrointestinal or urinary tract, or any injury that causes a deep cut or laceration. Bleeding in the gastrointestinal tract may present with dark or bloody stools. Bleeding in the kidneys or bladder may present as blood in the urine. For any of these bleeds, call your hemophilia treatment center and go directly to the emergency room. Early treatment of bleeding is especially important for people with hemophilia. You should follow your prescriber's orders for factor and dose as soon as you can following an injury. Contact your Soleo Health pharmacist or hemophilia treatment center for questions or concerns about factor dosing. Following the factor administration, you will want to treat the swelling and pain in the area using the Rice method. Rest and protect the injured area. Ice, apply ice or something cold to reduce the swelling and pain. Ice will shrink the blood vessels, slow the blood flow to the area, and help the body to heal. Compression, wrap the area with an elastic bandage. And elevation, keep your injured area at or above the level of your heart to reduce swelling. Remember that a person with a bleeding disorder will not bleed faster than anyone else. However, the bleeding will last longer if untreated. Seek emergency care if you or your child has signs and symptoms of bleeding in the brain, an injury in which bleeding will not stop, swollen joints that are hot to the touch, and painful to bend. If you have a bleeding disorder, you may be concerned about your activity causing a bleed, but physical activity can actually help prevent joint bleeds by strengthening muscles and helping maintain a healthy body weight. Keep active and maintain a healthy weight for optimal joint health. Always consult with your hemophilia treatment center physical therapist for an exercise plan that works for you. It is very important to keep a record of when you have a bleed and how you treated it. You will want to share this information with your hematologist, hemophilia treatment center, and Soleo Health pharmacist or nurse. It is important to know the early signs of a bleed, so that when a bleed happens, it can be treated and stopped as soon as possible. Early treatment is important to prevent damage in the body. There are various kinds of treatment for different bleeding disorders. Please consult with your Hemophilia Treatment Center team for questions about bleeds or treatments. At Soleo Health, we have pharmacists, nurses, and advocates that understand your bleeding disorder and partner with your healthcare provider.